The thing is that consent is such a huge topic. We forget that that is one of the basic human rights. Even generally in life, people would ask, what do you like this? Do you not like this? Isn't it? When we look at consent from a healthcare perspective, it becomes even more important. And when we talk about consent, especially with a very sensitive phase like pregnancy, labor and birth, there is autonomy of body. First of all, the woman has to be having that in the sort of place where she comes at it from. She should feel like she's able to make good decisions for herself. So I would say that consent starts in the prenatal period. It is not just about consent during labor and birth. It's not just consent about can I do an internal exam, but it is consent starting from, okay, what is the purpose of a test? What is the purpose of a scan? Do you understand it? Do you have additional questions about it? And when we look at it from that lens, midwifery is perfectly poised to offer counseling and practice consent both. Right? So without counseling, and if you don't know what are your choices, how can you really have an informed consent? I can come to you and say, for example, that your scan doesn't look good. What do you want to do about it? Or I feel that the best thing to do about this is to start a process of induction. Right? Say supposing, for example, somebody's scan says there is a low fluid level. And I can just come in and say, okay, your scan says your fluid level is low and I would like to start a process of induction. But in that situation, true informed consent is knowing both the pros and the cons. The ability to have all the pros, all the cons, and being able to say, okay, with all this in mind, for my particular condition, whether it is, like if there are two people with similar conditions, for example, one might choose that induction is appropriate for them and one might choose that no, I would like to wait after learning all the pros and cons. So to me, informed consent is about giving all the pros, all the cons, and also informed refusal. We don't talk about that. We always talk about what is informed consent. Right? But a person who has been given true informed consent should also be able to refuse it. One of the things that we very often do is to give them all the pros and all the cons, and at Sanctum we always believe that informed consent and informed refusal are two sides of the same coin, and that if a mom is being given or a family is being given pros and cons, they are equally welcome to refuse something as long as it is within a certain parameters where the safety of the mother and safety of the baby are well taken care of. Having said that, as a care provider at Sanctum, I also reserve the right to say, for example, that this doesn't look good to me. Even if you have refused it, within the practice parameters that I have, I would be able to say okay to this versus not okay to this, right? So I think it has to be more of a collaboration between the midwife and the parent, and that's how we always practice it. And because of the fact that they have been with us for a while, they understand the processes and they have been through the process of antenatal checkups where we have always had open communication and trust. It becomes easier for them to make a good decision for themselves because we are all on the same page.